A happy day to each and every one of you. I am Joanna Paisahe.
And I am Hariel Nescan.
We'd like to welcome you to our conversation about the presentations we made and the responses we collected from respondents at the assigned healthcare facility, which is the secondary healthcare facility or district healthcare services. But first, let's define what is the secondary healthcare facility. When we talk about secondary healthcare, we're talking about a second level of the healthcare system where patients from primary care are sent to higher facilities to see experts for treatment. Sarah District Hospital is the facility we've selected for this interview. Dr. Rodolfo Dumayas, the Chief of Hospital 2, and Chief Nurse Jennifer Salcedo served as the interviewees. So here are the 10 conversation starting questions we used as a reference.
Question number 1. What are the objectives or goals of the healthcare agency? This is the vision and mission of our chosen healthcare agency, which is Sarah District Hospital. The vision is hospital system as the center of excellence in the delivery of accessible health services, resilient and globally competitive Iloilo by 2024. As we can see, they still have 2 years to accomplish their vision. The mission is to provide quality and affordable, people-centered healthcare services in partnership with stakeholders for a healthy community. Question number 2. What are the existing policies, trusts, or strategies in order to meet its objectives or goals? As said by our respondent, Sarah District Hospital is the referral hospital of the 5 municipal health centers. These municipalities are composed of Sara, Concepcion, San Dionisio, Ahoy, and Lemery. We expect that cases that cannot be handled by the rural units of these 5 municipalities will be referred to our hospital for the management of their health problems. Question number 3. How is the flow of functions and responsibilities of the healthcare system? Referring to the organizational structure, Sara District Hospital is one of the 12 district hospitals in the province of Iloilo. One provincial hospital in Pototan. In northern Iloilo, we divided the area into 3 districts. Northernmost under Jesus Colmenares Hospital, serving the catchment of 4 municipalities. Sara District Hospital, serving 5 municipalities, and Barotac Viejo Nil V. Tupas Senior District Hospital, serving 2 municipalities of Barotac Viejo and San Rafael. In some cases that they cannot fully manage, these 3 district hospitals are expected to be referred to the provincial hospital in Pototan or other level 2 or 3 hospitals in the city of Iloilo.
Question number 4. What are the most common illnesses that are usually the cause of admission in the healthcare agency? So, as you can see in the presentation, diseases of urinary system, hypertensive diseases, influenza and pneumonia, esophagus, stomach and duodenum diseases, intestinal infectious diseases, tuberculosis, and also diabetes. So for the reports and statistics, here are the overall number of the most prevalent diseases that often lead to hospital admissions at the Sara District Hospital. Diseases of the urinary system is 196, which is 16.5%. hypertensive diseases 151, 12.7%, influenza and pneumonia 151, 12.7%, esophagus, stomach, and duodenum, which is 117 and 10.7%. Intestinal infectious disease or infection disease is 10.4% and number of admissions is 124. Tuberculosis is 64 admissions that recorded and 5.4%. And the diabetes is 48 admissions that recorded and a total of 5.7%. And the last is the COVID-19, 25.4, and it has been the leading cause of morbidity over the last 2 years, with 302 admissions according to the data. And that's all for the question number 4. Question number 5, what are the most common causes of death? So the 9 significant deaths have occurred in the last year are influenza, pneumonia, cerebrovascular diseases, COVID-19, ischemic heart disease, perinatal period infection, hypertensive disease, fetal growth disorder, and central nervous system infection. So I'll display to you the most prominent deaths and their total stats. So influenza and pneumonia is 26.5%, 41 deaths. Cerebrovascular diseases 22.6%, 35 deaths. Ischemic heart disease 11%, 17 deaths. Infection specific to the perinatal period is 6.5%, 10 deaths. Hypertensive disease 7 deaths, 4.5%. Other bacterial also 4.5%, 7 deaths. COVID-19 8.1%, 28 deaths. And the disorder related to the length of fetal growth is 5%. I mean as 5 deaths and have a 3.2%. And the central nervous system also have 3.2% and 5 deaths, same as fetal growth disorders.
Question number 6. What are the health services provided by the health agency? These are the services offered by the hospital under the public health services. The following are ABTC, or Animal Bite Treatment Center, a special unit for the prevention and control of rabies. It is a program accredited under the Department of Health. Prenatal OB, to take care of women during their pregnancy, labor, and delivery. Surgery operations, dental services that includes dental cleanings, cosmetic dentistry, x-rays, complete exams, and more. Orthopedics, to provide care to patients that have problems with their bones, joints, ligaments, tendons, and muscles. Pediatrics and internal medicine. And lastly, the hospital is also equipped with pharmacy and laboratory, X-ray, and ultrasound. Question number 7. What laboratory tests are performed in the healthcare agency? State the type of laboratory according to service capabilities. Sara District Hospital has a Level 2 laboratory. Their laboratory can perform all the procedures that can be done in a Level 1 laboratory. Their equipment are mostly semi-automated and they are more equipped than Type 1 laboratories. They can cater CBC, complete blood count, which includes RBC count, WBC count, and total amount of hemoglobin in the blood. Another one is blood chemistry, which involves the measurement of the amount of substances found in our blood. And lastly, COVID-19 testing, which is used to diagnose people infected with SARS-CoV-2, the virus that causes COVID-19. Question number 8. What is the ratio of health personnel to care recipients? In Sara District Hospital, the ratio of health personnel to care recipients is 1:25. In the hospital, the total nurses sums up to 56 employed nurses. On the other hand, 92 admissions were recorded in the past year. Question number 9. What is the ratio of health facilities to care recipients? One district hospital that caters 5 catchment municipalities. Those municipalities includes Sara, San Dionisio, Concepcion, Lemery, and Ahuy. And lastly, question number 10. What is the role of the community in the maintenance and promotion of health and prevention of illness? As stated by our respondent, we are in coordination and feedback as to the health status and healthcare, which are composed of 5 municipalities. We expect that if cases cannot be handled or it is beyond our capabilities, we refer it to Level 2 or Level 3 hospitals in the city of Iloilo.
Thank you for your time and for listening, everyone. So I want to acknowledge and appreciate my team for their hard work and complete collaboration. To Miss Obanyana and Miss Magno for making the interview happen on time. And also to Mr. Hariel Nonescan and myself, Joanna Paisahe, for making this presentation an accomplishment. Thank you all and may God be glory.